So let's see. This is a little bit more of a kind of a narrative introduction, which you can do. I mean, honestly, you can just do, this is a research paper. You can do kind of a straightforward introduction. So bringing in some numbers, prevalence of borderline personality disorder, use of DBT for it. So she's kind of setting up her paper here, right? And she goes into what is BPT based on the DSM-5 criteria. What are the symptoms? So she's introducing BPT. And then she starts talking about what are the successful treatment modalities for BPT. It introduces dialectical behavior therapy. So there's some description of what DBT consists of. So she's describing the therapy itself. And again, this would be the place where you can have kind of a high level reference, right? Because it's just sort of in general, what is the universe of DBT? Like what happens as a standard or element of that treatment? So she's still talking about the skill development and some of the specific interventions with DBT here. The areas that are targeted, DBT. All right. And then I think she starts going into studies down here. You need headings. Put headings in your papers. This one could use a few more headings. Just looking here at some changes in the brain seen in patients with BBT following dialectical behavior therapy. So this is kind of a neat twist, right? So do we see any actual neurological changes? Do we see any kind of plasticity in the brain with self-regulation after introduction of this treatment? So let's see. Conclusive sense that life before treatment spirit. So looking at some research showing increased hopefulness, quality of life changes based on use of DBT. Let's see, problem solving results. So, pulling different studies, kind of looking at what seems to improve or not improve using this particular treatment. Regulating motions. All right. And then she's talking about some caveats. So dropout rates with DBT, some research on why dropout rates are happening, how that may be affecting really our confidence in the findings that she mentioned up above. That's important. Some treatments are less well tolerated, and so we can't just go with the narrow range of data on those who conclude treatment. So other treatments, not so much. Like if you're just looking at general REBT or Beck CBT for depression or something, dropout rate is probably not going to be a big issue. Looking at borderline personality disorder or OCD, dropout rates are an issue. So you have to use your judgment. If they're impacting the delivery of treatment, then you probably need to discuss that. So then this is where she kind of goes into some subpopulations. So she's pulling specific studies, looking at different groups. Adolescents right here. Let's see, talking about more about adolescents. Let's see, borderline severity in general psychopathology. Young adults, here we go. So this is some research on young adults, young people with ethnic minorities. So now she's kind of pulling some other data here, looking at some differences in effect size. So you see she's kind of working her way through some specific groups. This is also interesting, American Indian and Alaska Native populations. So, all right. And then she is, as another group or subgroup, she's looking at co-occurring diagnoses, which is hard to find good research on that, right? Like when researchers run protocols, they typically start out with just this ideal pure sample of trying to find people with only that diagnosis and make it the research as clean as possible. But the reality is that many of these conditions co-occur with at least one, if not several, other psychiatric diagnoses, and borderline personality disorder is one of those. So this is kind of a nice point here, right? It's like, well, okay, so now in the real world, 25% have overlapping PTSD symptoms. So can we pull some research that looks at use of DBT for borderline and for PTSD? So she's kind of tackling that a little bit, pulling some studies in, straight DBT and then EMDR with DBT and then prolonged exposure with DBT. So she's kind of playing with that. Okay, in real world, there's a lot of trauma. So if we can't ignore the trauma. So let's look at what we've got in terms of research addressing that. All right, this paper is pretty long. Yours hopefully won't be over 20 pages. So I'm not suggesting it needs to be. This one just happens to be a little bit longer. She went over, I think because she's doing so many subgroups, kind of got into that. That's okay. Okay. One thing I would say about this is the conclusion actually needs to be a little bit more robust. So she's still kind of talking about some subgroups coming through here. And then at the end, the conclusion is sort of small. Your conclusion should pull together the themes that you found in terms of the effectiveness of the treatment for your disorder, and then maybe, some caveats or some limitations or things that really need some further examination because of dropout rate or because there's a specific group of people that really need to be included that have not been included in the research, or because there's a co-occurring diagnosis and you couldn't find anything on treatment protocols for that. So bring together your main findings and then point out whatever those limitations were that were kind of threaded through the paper. Also bring some of those into your conclusion. And then you go to your references. And I'm sure for this one, there's a lot of references. But yeah. All right. I saw some hands go up.